I'd either be dead or I'd be in prison.
My life revolved, everything was around drugs.
What was your life like before you came here?
A wreck. It was a wreck. 100% a wreck.
Reckless. Basically, I didn't care if I lived or died.
Completely unmanageable.
It was kind of going sideways, to say the least.
I didn't think I would die though, so I did anything and everything that I could get my hands on.
Unmanageable, chaotic, yeah.
The people you just heard are your neighbors and mine. They're fellow Ohioans. They're from all walks of life, all backgrounds, colors, and cultures, who for various reasons got sidetracked and needed help. I'm Tracy Maxwell Hurd, Executive Director of Multi-Ethnic Advocates for Cultural Competence, Inc., or MAC. We're constantly advocating and looking to tell stories of the folks you just saw, to shine a light on societal challenges and the programs that tackle them with action, accountability, inclusivity, and cultural competence. It turns out every person you saw at the beginning of this story went through a program that brings people together for things like counseling, addiction services, housing, and a job. This program saves your tax dollars too. We traveled across the state to find out more, as this whole effort is centered in places you'd never suspect. A courtroom.
I can't go into any Walmarts, I can't go into any Home Depots.
I was unemployed and making money other ways.
If it was something where someone's like, oh, if you do too much of this, you could possibly like overdose or something worse could happen. I mean, I didn't think twice about it and did it anyways.
I would be dead, 100%, if it wasn't for drug court or Judge Mattia.
All rise.
Okay, be seated, everyone.
When you're in active addiction, it takes you places that you never thought you'd go. And I'm talking about like low places. I used to tell all my friends before I started getting really bad off, they'd go into Walmart and stuff and steal. And then they'd take the items back and then they'd get a gift card for it. And I'd tell them, like, I'd laugh at them like, you guys are crazy. Like, I'd never do that. I can't go into any Walmarts, I can't go into any Home Depots because I stole from all those places and I got banned.
So you're working on holding yourself accountable? Yeah. Okay, good. Excellent. We'll see you next time.
Came through that door, orange scrubs on, and I'm just beat down. I'm beat down. I was detoxing. You know, I didn't care about anything. I'm trying to get my mind wrapped around that he's about to send me to prison. He said, if I give you another chance, what are you going to do with it? And I said, it will be, you know, nothing but positive things from here on out, you know.
Willie is somebody who, from as early on as he really was eager about working a program. I'm Judge David Mattia. I'm a common pleas judge in Cuyahoga County. I've been here for 24 years on the bench, and in 2008, we started drug court here.
Chief Justice Moyer was the one who really started drug courts, along with the Drug and Alcohol Agency, which is now merged with the Mental Health Agency. And he had a real passion about it, and the two of them worked together. It was a concept that was very new. When I joined the court, there were only like 7 drug courts, and he just really believed in them. And so they started talking about drug courts and promoting drug courts. Then when I got on the bench, I learned about mental health courts and how that, you know, probably 2/3, 3/4 of your drug court people also have a mental health issue. So I became an advocate on mental health courts, and that kind of expanded into many other different fields. So now we lead the country in the number of drug courts, mental health courts.
Specialized dockets really captured my heart years ago. My name is Lori Chris, and I'm the director of the Ohio Department of Mental Health and Addiction Services. I worked for a program that worked with homeless women and their children. And for me, I worked a lot in the housing space, and I was able to support women in their goal setting and achievement with moving to independent housing and having real residential stability with their families. And it's really rewarding for me today to still see some of the women that I got to know then thriving in the community. They've got graduate degrees, they're working, they're really living their whole purpose in a way that I know that they could only dream of at that time, and that specialty courts were able to help play a small role in their goal achievement along the way.
I lived a very carefree life, reckless life, very selfish, didn't care what happened to me or to the people around me. Did what I wanted to, lived by my own rules. I also didn't think I had a problem either with what I was doing with my lifestyle at first. Up until I got like a really big reality check that I think I might have an issue, but even after that I still didn't think. It took a long time for me to admit that anything was wrong with what I was doing back then.
The disease does not discriminate.
This was started when I was about 16, was when like the drinking, it didn't like start automatically with hard drugs. It started out with drinking and marijuana use and pills, prescription pills.
It hits every economic, social class, race.
I can say I've done a lot of mostly everything, but heroin and crack were my two that I stuck to the most.
If you're unlucky enough to have either life circumstances or the type of gene that makes you susceptible to substance abuse and dependency, not just abuse, but dependency.
I sold myself to make money, to get high. What else? And just driving around with what I would drive with no care in the world. I'd completely under the influence and totally unsafe for everyone around me. I'd put people's lives in danger, didn't care. Put my own life in danger, I didn't care.
Everybody watching this knows someone in their family or in their close circle that has problems.
I have had several family members with serious mental illness. A father-in-law who had bipolar. Despite all the contacts and all the reaches I had into government, I could never help him because our laws are designed that unless he's so sick that you can get him hospitalized, you really can't get them treatment unless they are willing to go. And that's one of the biggest problems we have with treatment and the mental health side. Drug side is a little easier because most of the drugs are illegal, and so you got the clout of the criminal conviction to try to get them in treatment, but it's much harder on the mental health side. And so I got to see a lot of these issues up close and personal from family members, and I had friends that frankly had committed suicide that challenged me to really want to do something in the space. So I had those personal connections as well. My name is Evelyn Stratton. I am a retired justice from the Supreme Court of Ohio. I actually retired earlier than I needed to because I became very passionate about mental health and drug addiction issues and wanted to really spend a lot more of my time on that.
There's a much greater understanding today of mental health and addiction issues than there was even 5 years ago, but certainly 30 years ago when I started into this career, that people understand them as brain disorders or as conditions that are health-related and not a moral failing or a poor choice that somebody's made, but still at that individual level. So I think that's true in society more generally. I think that's true in the media more generally, and I think in younger generations. But still, I think there's, at the individual level or at the family level, a real reluctance to disclose that there's a substance use disorder or a mental health condition, right? And that creates not just a personal, shame or embarrassment, but it keeps people from getting help. And it keeps people from getting help early on in their experience with the illness, which then just allows the illness to progress, and the consequences of untreated mental health conditions or addiction issues really compounds the challenges that they have with those conditions in the first place.
So one of the requirements there is you got to find a sponsor. And so a sponsor is like somebody that you would look to for guidance, that's been sober for time, to show you how they did it. So now, I have to make a decision. I have to come up to another man and ask him, I need your help to show me how to live my life. And that's uncomfortable. That's uncomfortable because I myself as a male, I don't want to go ask another man for help, And mind you, I was in active addiction since the age of 19. I'm 35 years old today. I just had a birthday in May. I didn't know how to write a check. I didn't know how to balance a checkbook. I didn't know how to go grocery shopping. I didn't know how to do any of that stuff because all I cared about was getting high.
Honesty's real important to him.
Yes, it is.
Were you honest with him the whole way through?
No, I was.
What about that?
In the beginning, I was a very dishonest person. Half the time I didn't even know I was lying. Like, I would get in front of him and I'd spit out some words and then I'd walk away because he knew I was lying. Everyone else knew I was lying, but in my mind, I thought everyone believed me. Actually, when I found out I was pregnant was when I said enough is enough, because I didn't want to be a mother, or I did not want to have a child with him saying, oh, my mommy's gone, I don't get to see my mom, or a child that has to talk to his mom behind bars. I didn't want him to have an unstable life that I had growing up. That's what really, really woke me up, was getting pregnant. Because even up until that, I was still off the wall doing whatever I wanted, even in drug court. Because I started in 2019. I had a lot of relapses in the beginning. Didn't care, I didn't take the program seriously, and that's what snapped me out of it, was my son.
And being honest is a huge part of being successful in maintaining sobriety. We understand that relapse happens, and if you're honest with me, you're not going to be incarcerated for a brief jail stay. But if you lie about it, that's what you're going to get penalized for. We follow again a model that says, you should sanction people more severely for violating proximal goals than distal goals. Honesty or showing up for a meeting is a proximal goal. Being sober, that's a distal goal. So, if somebody's 3 months into drug court and they relapse, the model says don't incarcerate them for that, because being sober is a goal in the distance. Now, if they're 2 weeks into drug court and they left treatment or didn't go to meetings or didn't show up for the case manager, that's an easy goal to obtain, and that's where we need to get their attention.
When I tell you that I thought I was sitting in the county jail, our county jail, trying to wrap my mind around that he's about to send me to prison, because I've already used all my chances up with him, before. And I didn't think he was going to give me another chance, but he did. And it was that one that mattered, because I completely changed my life around for the better, and I couldn't have did it without him.
As time went on, something clicked in him early on that he wanted to be in the field and help other people. And I remember, writing him a little recommendation when he applied for a job at the treatment center that he went through, Stella Maris, and now he works there. And it comes full circle. Patient becomes provider. So
now I'm on the other side of where I used to be. So now when guys come in, just like how somebody did my intake, I'm doing their intake now. I couldn't even fathom it. It was just, I cannot believe that I'm working here. This is the place that I recovered, that helped me recover. And now I'm working there.
It's such a gift, but it was so much work to get to this point, and it still is a lot of work to stay in this point where I'm at. but I'm willing to do that work every day. If it wasn't for drug court, I would probably have a son who wouldn't be mine. I don't know where I would be living. I'd still probably be using if it wasn't for drug court, because I never thought I had an issue. If I would have never gotten in trouble in the first place, I probably wouldn't be here today. Like, I might most likely would be dead by now.
To be where I was and to where I am today is just, I still, when I lay down at night, I thank God, like, for giving me a second chance, because I wouldn't give this thing up for anything.
My son's name is Danny. He was named after my brother, who passed away 2 weeks before I found out I was pregnant. He saved my life, really. My son really did save my life. I give myself credit, but if it wasn't for him to begin with, I wouldn't be here. And I look at him, I thank him every day for that, because he's amazing, and I love him more than anything in this world.
Oh, it's the most fulfilling thing I do as a common pleas judge. To see you take that lump of human coal, and with just a little encouragement, you know, you turn it into a diamond. It's great to see people, you know, after they graduate, I see them on Facebook, you know, they're starting families, they're taking their kids trick-or-treating, they're excited. I had one woman who was excited to go to a candle sale at Bed Bath & Beyond. I mean, something as mundane as that is giving this woman joy now, and to remember what they were like when they entered drug court.
I am so thankful to be a part of witnessing some of the reunifications that we've seen, especially through family dependency courts that happen in our communities, and being able to see children reunited with their families. That's probably one of the most difficult things as an adoptive parent of an older child. There's a longing and there is a bond that children have with their biological parents. And when that's not satisfied, it produces a trauma and a hardship in a child's life that is lifelong. Seeing those reunifications happen and seeing those children reunited with their families has been some of the greatest opportunities and successes that we've seen and we hear about.
The transformation, I mean, it's amazing I get paid to do this, so that's great. It beats the heck out of, you know, the revolving door of sending people to prison and having them get out and then come back because they haven't solved their substance abuse issue.
My name is Lydia Caraha, and drug court is the reason I'm standing here today.
My name is Willie Harris, and drug court saved my life.
Well, good afternoon. The need is spectacular. I always say it's like the old starfish, you know, the person walking down the beach and throwing the starfish back into the sea. There's so many starfish, how are you ever going to save all these starfish? And the person says something to the effect, well, it matters a lot to that starfish I just threw back in. And I know the story is somewhat like that, but for those people who come in and we get their attention and we get their buy-in, it's huge.
You know, the judges that we have in the communities that offer this program really see value in recovery services. They really see value in giving people second chance opportunities. And so I'm appreciative for those judges that are looking beyond consequences to see how we can utilize treatment in a more effective way in individuals' lives who definitely benefit from it. Jail is not the option for everybody. My name's Misty Cromwell, and I am the Executive Director for the Muskingum Area Mental Health and Recovery Services Board.
I love the opportunity to come to the drug court graduations. This is probably my favorite part of my job because we get to come to work every day to help people like you get back on your feet. I guarantee you this is probably the only drug court graduation in the state of Ohio, if not the country, where you get a poetry reading. I was introduced to this poem called The Race, and it really kind of stuck with me, and it kind of stuck with me in that same image, in that it's not about being, success in life isn't necessarily about winning the race. Success in life is about finishing the race.
Congratulations. I've worked with every one of you. You deserve it. You worked hard.
And so now the moment we've all been waiting for, I get to do my professional poetry reading. They all lined up so full of hope, each thought to win the race, or tie for first, or if not that, at least take second place. And fathers watched from off the side, each cheering for his son. Each boy hoped to show his dad that he would be the one.
When they're talking about this being a very hard program, it is a hard program.
And one boy in particular, whose dad was in the crowd, was running near the lead and thought, my dad will be so proud. But as they sped down the field across a shallow dip, the little boy who thought to win lost his step and slipped. Trying hard to catch himself, his hands flew out to brace. Amid the laughter of the crowd, he fell flat on his face.
Mike and the drug court team and all of them for, believing in me when I was going through everything.
So anxious to restore himself, to catch up and to win, his mind went faster than his legs, and he slipped and fell again. He wished then that he had quit before, with only one disgrace. I'm hopeless as a runner now. I shouldn't try to race.
A year ago, I didn't even have a cell phone.
We're changing our future. And that's the thing. I said we can't change our past, but we sure can change our future.
Now I have my own house, my wife's in the back, a car, pay bills, I got a cell phone.
But trying so hard to catch the lead, he slipped and fell again. Defeat, he lied there silently, a teardrop from his eye. There's no sense in running anymore. 3 strikes, I'm out. Why try?
The judge, the clinicians, soldier nurse, all of them, they believed in me before I could believe in myself.
So up he rose to run once more, and with a new commitment, he resolved that win or lose, at least he wouldn't quit. So far behind the others now, the most he'd ever been, still he gave it all he had and ran as though to win. 3 times he'd fallen stumbling, 3 times he rose again. Too far behind to hope to win, he still ran until the end.
Some of you guys come in broken, and now look at you. Every one of you guys that I'm looking at now, all 5 of you guys all have good jobs and doing very, very well.
And even though he came in last, with head bowed low unproud, you would have thought he'd won the race to listen to the crowd. And to his dad he sadly said, I didn't do too well. To me you won, his father said. You rose each time you fell.
I've definitely bettered myself. I have goals, ambitions, and I'm striving to be a better person each and every day.
And now when things seem dark and hard and difficult to face, the memory of that little boy helps me in my race. For all of life is like that race, with ups and downs and all you have to do to win is rise each time you fall.
My next goal is to buy a new car.
I want to go to CDL school, get my CDLs. That's what I want to do.
I'm going to get my degree in maintenance for robotics.
I got a mentor position at a treatment facility, and I get to mentor clients that are in earlier stages of recovery and just kind of share my experience with them. And that's rewarding, very rewarding.
One of the things that each graduate will receive is a coin. This coin has inscribed on the back, just in case you forget. It doesn't say if you're going through hell, keep on going. It says, rise each time you fall, the race. My name is Keith Spaeth. I'm the judge of the Butler County Drug Court Program, and I've been doing this for 22 years. So we're going to present this to you. If they choose drug court, maybe they avoid a prison sentence. There might be some initial coercion to get them here, but once they're here, then it's got to become real. They got to develop their own pride, their own motivation system to get through Well, to get through sobriety, to get through the program.
In fact, people who enter a specialty docket, it's a much longer commitment. You can serve your 30, 60, 90 days or get probation, you're out on the street, and you're done. Or you can go into a specialty docket like a drug court. It's a 2-year commitment, but you will finally get help. And it takes a while sometimes to convince them they really need to get to that level and commit to that. So it's not a soft on crime. You have a longer period of time you're going to be involved in the court system. So some people refuse to go into a drug court because they want to just serve their 30 days and be out. And that just obviously gets them nowhere. And sometimes they get to that low point where they realize, okay, I'll try the program. I'll see if I can do it.
We get good results. And at the end of the day, I think it's obviously a good investment whenever you can help people. But I think we get good return on our money because people, as I just said, they're restored to the workplace. They're restored in their family. They are not in our jails. They're not in our prisons. They're not buying illegal drugs. They're not in our medical system.
Probably 10 or 15% of the people who are arrested with drug court and mental health issues consume 90% of the resources because they cycle and cycle. And a perfect example is a gentleman named Brent out of Delaware County. For 8 years, when he turned adult, because he had been in trouble as a minor, when he became an adult, for 8 years, he was in the hospital system over 400 days, the jail system over 400 days, the prison system over 400 days, rearrested over and over. And it cost them over those 8 years, because we had a formula we could plug these numbers in. What does it cost to get arrested? What does it cost to go before a judge? What does it cost for a jail bed day, for a hospital bed day? It cost that county $644,000 over the 8 years. One person. They put him in supportive housing with robust services, support services, and in the last 6 years, he's never been rearrested, he's got a job, he's never been rehospitalized, and it would have cost him only $244,000 for all those services over those 8 years. And so what I tell people is if you don't change that paradigm, that person will cost you $400,000 more over the next 8 years with no good outcome. One person. So we can demonstrate over and over and over the cost savings.
Mr. Hollingsworth has made significant changes. What's been revealed to me is he is also a quality individual and a quality person. A talented person. The results seem to be getting better and better every year. I think we get better at it, but by the same token, we're somewhat more selective. So the results are long-term sobriety, long-term employment, long-term reunited families, parents taking care of their children, and just restoring people to their families and to their communities without being broken, and giving people a sense of a future, a sense of hope.
I love a lot of things about drug court graduations. One is the personal accomplishment that is visible in the way that people carry themselves and the looks on their faces as they stand there graduating from drug court, but also the pride that their family has for what accomplishments they can see personified there that day too. And I've seen, kids with flowers for their moms and people taking pictures. And it's truly a celebration of accomplishment, of recovery, of life in the most joyous way.
It's been an absolute pleasure to have you in drug court. I can remember your first day, and I think your mom was here. I met her on the way in. I said, Mom, just let us have them. And because that happens so many times, sometimes family members who mean well sort of interfere with the messaging I'm trying to get accomplished. And I've told Ron several times now since then, I said, I told your mom a year ago not to come back, and by God, she has not. So, but she's here today, and we're very proud of you.
Thank you.
To see the court personnel, the judges interact with the graduates or even people who are still in the programs in such a human way, and to really have, again, that accountability, but that we're in your corner, we're here for your success, we're supporting you. It's just a beautiful moment to see the humanity in every corner of the room.
Jill has come into drug court since that time, has not missed a beat, always a pleasant smile. She works, she's employed, she's a good person, and she's made tremendous change. I know she has the support of her family. Congratulations.
Thank you.
We want to instill a sense of pride in everyone of self-reliance. They don't need to depend on anyone. They're going to have their own job. They're going to have the skills they need to stay sober, to, if they've got kids, to take care of their children. But they're not going to be dependent upon anybody to get the daily necessities of life.
My name's Leonard Hollingsworth III, and I'm a drug court graduate.
My name is Michael Fields, and now I'm a drug court graduate.
Okay, my name is Ronald Reckner, and I'm a drug court graduate. Thank you.
My name is Jill Smith, and I'm a drug court graduate.
We need to build a system where people don't have to get arrested before they get help. I'm getting a little gray and up in age. If I'm having chest pains and think I might have a heart attack, I know where to go. I go to the ER or I call 911. If I'm that same person who has a heroin problem and I'm sick and tired of being sick and tired, I don't know where to go because the ER is not going to have detox.
For a 6-county area, one treatment center that we support that does withdrawal management or provides detox services at that level, that's right below a hospital level of care that's needed. One treatment center for a 6-county area that's supported with public dollars is not enough.
Every hospital should have detox. It's low cost care. It's palliative medicine, basically. Somebody comes in, you help them with their withdrawal systems, with medication, and then you do a little initial counseling, and then you pass them off to a treatment provider where they'll stay for 90 days. It's really not unlike getting a hip transplant. You get the operation, you go to rehab. It's the same thing if we design a system where hospitals had detox, everybody would know to go to the ER, they'd help you through detox, and people don't want to detox because they know the withdrawal symptoms can be terrible. But if you let the greater community know that we can get you through this with less discomfort, more people will be ready sooner to get clean.
Does he have a point?
Absolutely, he has a point. It's really hard to get the hospitals to focus on adding beds for mental health or adding beds for drug treatment because they don't generate that kind of money.
The brain is part of the body where we don't disconnect at the neck. And so making sure that the healthcare system understands and feels invited and included in the planning for behavioral health and the connection to that community-based care that will really support someone for the long haul. But the hospitals do play an important role in that brief, acute care that a person needs. We could do a lot more to have those be one-time episodes instead of returns into a hospital system.
If somebody goes to medicine, you got a choice between being a internist, an orthopedic surgeon, or an addiction psychiatrist. Well, you got to incentivize it a little bit. An orthopedic surgeon is going to make the most. Why is that? Why has society chosen to pay reimburse for orthopedic surgery on so much more than behavioral health? That's got to change.
We have a workforce problem. We don't have enough psychiatrists, we don't have enough mental health care workers, we don't have enough drug specialists. the more we expand, the more we need those type of people, and we don't have enough. So I know that the governor's office is really focusing on workforce. Director Chris is focusing on workforce issues. We've got to have people to treat them, and that's one of our biggest issues right now.
The Centers for Medicaid and Medicare Services, CMS, needs to really get involved and up the reimbursement rates for doctors who choose to go into these fields. You know, hospitals aren't doing it because they, one, don't want to, behavioral health's messy, patients are non-compliant, but two, it's not a profit center for nonprofits. And that needs to change, and that can be done at the federal level.
The reimbursement rates for mental health and addiction are something that have needed to have a look at a national level for years. The federal parity law was passed. Ohio aligned our laws with the federal laws recently as well. And so we are making progress in it, but there's much work to be done and much work that's underway in that space. But it's not just those medically necessary services either, right? It's investing in all of the services and supports that help someone get well and stay well if they have a mental health condition or a substance use disorder. So the peer support, the recovery community organizations, the housing that may be supported in some way in services, those are things that fall outside of health insurance, but are vitally important to helping someone live to their full potential as well.
All the states have lowered their blood alcohol rate to 0.08%. Remember how we did that? The federal government said, hey, Ohio, you don't have to lower your DUI threshold to 0.08, but if you don't, you're not going to be able to participate in the Federal Highway Fund program. Well, we could do the same thing with hospitals and detox. You don't have to have a proportional number of detox beds available to your size, but if you don't, your CMS reimbursable rate's not going to be 100%. We're going to cut it to 85%. You do that, every hospital in America will have detox available, and that's simple.
I just know we are working very hard on building a much stronger relationship with the hospitals. We have a program that we just started in Ohio called the Multi-System Adult Program. And the Department of Mental Health started it. I'm on the committee, and they look at the frequent users. How many times you're in the hospital, have been arrested, all the systems you touch, and they're focusing on changing the paradigm of those highest users. And one of the biggest gaps they found when they started this program is the hospital communicating with the mental health board. And so that's, okay, we've identified a problem. Now let's figure out how we fix it. How do we get that hospital to know that there's resources for this person so they don't recycle back in and out of your system? And so there's a lot we're doing in multiple levels to try to improve that.
That's where we're focused right now, is inviting them into the system, recognizing that hospitals are part of the behavioral health care system. They're not an institution set apart. They're part of this community-based response for mental health and addiction care. And also really integrating not just physical health care and behavioral health care, but understanding that a person with a substance use disorder most likely will have some co-occurring mental illness, and a person with a mental illness may likely have a co-occurring substance use problem. And so really, truly just seeing the person for who they are, understanding what happened to them to help them arrive at this point, and just working towards helping them heal and live to their full purpose is what our goal is right now.
And sometimes that still means that I pick up the telephone or I get a phone call, and I'm encouraging you, keep moving forward, keep going to your meetings, keep doing what you need to do, because it could be worse. The wake-up call, so to speak, that they needed to be able to recognize that life is short. This opportunity of a second chance might not come again, and that I need to take a hard look at myself, my life, and what I'm doing, and make some adjustments where I need to make them because I might not be afforded it next time. So I'm really thankful. I think that drug court was extremely helpful. Yes, both of them are living in sobriety as we speak. One is making plans to really separate from family. So this is really a true test and moving to another state here shortly. But yes, both are living in sobriety. Both are doing well. Both are standing on their own 2 feet.
So, as you've seen, Ohio drug courts serve as a crossroads, really. Our cameras were there for drug court graduations, and they were there when judges sent people back to jail. It is still a courtroom after all, and honesty prevails. You also witness drug courts flat out work. They change lives, save lives, and protect the next generation of lives. So we ask you to do 2 things. Number 1, share this story. When you do, you break stigmas around mental health, substance misuse, and you could direct someone to real help. Secondly, tell your elected officials to fully fund behavioral health because we truly have a dual crisis: the need for services and the need to recruit more professionals in these fields. As you saw, this is a matter of life. A life turned around, a life behind bars, or a life no more. Let's work together to save a life. I'm Tracy Maxwell Hurd of MAC. Thank you for watching Ohio Drug Courts, Real, Honest Impact. Follow us on social media and support our commitment to transforming systems through cultural competence.